Hello, everybody. This is Joe Freudenberger here with Cup of Joe, conversation around healthcare topics that are affecting all of us. And I'm welcoming back Dr. Shayla Sharmin, who is nurse practitioner in our medical group, for a continuation of last week's conversation on preventative care. Thank you for joining us again.
Another topic or preventative care we're trying to push out is cardiac screening. Now that calcium scoring is highly popular among cardiology practices, so we're trying to push that screening to the average population who has high family history of cardiac diseases, early mortality rate in the family, or it could be just a slight elevation of lipid over the years and which is ignored and just count as a stable result. So we're trying to push that calcium scoring to see slow plaque buildup. If we catch it early, we can prevent that disease and ongoing mortality, chronic problems going forward.
Well, that's really surprising, even for a person like myself who is in the healthcare field, to realize that insurance companies are pushing back on what seems to be relatively low-cost treatment approaches and waiting for a much more serious problem to arise, like cancer or cardiac, where intervention is required. So, and you spend a lot of time, I presume, fighting with insurance companies to do basic sort of testing. Sounds that way.
Yeah, so that's kind of stays behind the shadow, away from average
Yeah.
consumers. We are going back and forth with the insurance a lot. It just requires more documentation, more providing future prognosis, mortality rate.
Yeah.
So it's an ongoing battle, I would say.
Yeah.
But
It certainly sounds that way.
yes, we have been. If all the providers come together and continue to fight, it could be just for a medication
Yeah.
or something screening, as we're talking about. But that pushes the insurance to provide greater coverage for the
Perfect.
patients.
All right. Well, thank you so much. This has been very educational. And thank you all for joining us for a Cup of Joe. And join us next week for another chapter in this interesting journey that we're taking through our American healthcare system. Thank you so very much and have a wonderful day.